Here's some interesting statistics for you. 1 in 5 adults and 1 in 10 children are diagnosed with a mental condition each year. That, according to the National Alliance of Mental Illness. Here to talk about the problem and what can be done to help people as we mark awareness of this issue throughout the month of May is Dr. Jaquelyn Duval-Harvey. Thanks so much for coming in and chatting with us about this very important issue.
Thank you.
And for starters, those numbers, 1 in 5 adults, 1 in 5 teens, and 1 in 10 children diagnosed each year, that seems kind of high. What are your thoughts on the numbers themselves?
Well, the numbers are difficult to really explain because essentially, children, when they are diagnosed, are usually diagnosed because they're exhibiting some kind of behavior that's problematic. So what we try to do is catch those behaviors early. For example, in school, in daycare, if there are signs that a child is having difficulty sitting still, paying attention, doing the things that children need to do in school so that they can learn and be productive citizens, there are opportunities for interventions where a clinician in the school can work with them, can meet with the family, can understand what's going on in the context of the whole family unit, not just the child, because typically children experience issues that happen in a family context. There may be some loss, there may be some issues around not being as healthy as they need to be. Maybe sometimes as babies they are difficult to soothe. So there may be a lot of issues that don't necessarily become serious mental illness problems. And so that's an opportunity in young children to do early identification and prevention.
And what are the most common types of mental disorders? You have depression, schizophrenia, and the list kind of goes on and on. What's the most common?
Actually, you named one of the most common, which is depression. The second is anxiety. So, for example, you're very comfortable doing what you do, sit in front of a camera. If someone has to do a presentation as part of their job, they may have a great deal of anxiety and nervousness around doing that. If they overcome that, then they're fine. But sometimes people actually can't overcome it. And it can get as serious as not leaving their home in case of phobias. And it can actually impact their ability to live comfortably and to work comfortably. So again, sometimes it starts out generally, mildly. But if it impacts a person's ability to function in daily life, then significant intervention needs to happen so that individual can actually be a member of society.
As we mentioned, May is Mental Health Awareness Month. Yes. Last week, the county launched a program called Step Forward.
Yes.
To kind of break away the stigma having to do with mental health issues and problems and so forth. Tell us a little bit about it.
Sure.
And I know we have a poster on this side with a hotline number and some other information that will probably give people a shot up. There it is. Okay. Yeah, Doc, tell us a little bit about Step Forward.
So while 1 in 25 people essentially will have a serious mental health illness, we know 60% of those individuals will not get treatment. And it's because people are embarrassed. Sometimes if the issue is a substance use disorder, there's a lot of shame around having that kind of an illness, and people are labeled as crazy. And so that's not something that people want to share and tell others about. And so people hide. And that stigma prevents people from actually getting treatment that is effective. And so we want to make sure that people know that if there is an issue, there is a significant amount of help available. There's a full continuum of services that can actually address their needs. If they start with an assessment process and develop a plan of care, they can be stable, they can recover, and they can do well.
And what are some of the services? You mentioned assessment, care, and so forth. Then what are the actual services that the health department offers?
So we have services in the county ranging from outpatient treatment, where it's basically once a week, going in and meeting with a counselor, to more intensive services, even in outpatient, where you go 2 and 3 times a week. In an outpatient setting, medication can be added to help stabilize that individual, particularly if the individual has the kind of disorder that responds well to that. In some cases, we may need to actually hospitalize someone if it becomes so serious that it becomes life-threatening.
And just to kind of wrap things up here, Dr. Duval-Harvey, the month is meant to put a spotlight on it, but we know that this is an issue that affects people throughout the year. So how can the community, how can folks, your neighbors and so forth, support someone who is suffering from a mental illness throughout the year?
Well, so family can usually tell there's a change in behavior. The individual knows for themselves if there is a change, but they may need the support of family members and friends to actually get help and get information. So what we've done with the campaign is make it very easy to reach out for help. You can text it. You don't even have to have a conversation with anyone to share the information. But if someone has concerns, it's important to reach out and ask some questions to find out whether this is serious enough to warrant an intervention, Or if they give information that this is a transient situation, then something less intense in terms of treatment can happen.
Okay, we appreciate your time and for coming in and sharing all that great information with us. We're going to tell people exactly where they can get some more details as well. You see the website right there on your screen, pgchealthzone.org, for all the details on the campaign and everything else.